Welcome to another deep dive into some really fascinating material.
It is.
As a nurse and a student, I know you're committed to lifelong learning, and that's really what this show is all about, right?
Absolutely.
And today we are going to take a deep dive into the world of psychotherapeutic drugs.
Yeah.
These are medications that exert their effects on mental processes and are used to treat a range of conditions.
Right.
Everything from the everyday anxieties we face to the really complex and serious psychoses.
Yeah, and it's important to note that a significant number of adults in the U.S. are actually affected by anxiety disorders.
Really?
Yeah, it's a staggering 18.1% of the population.
Wow.
That's more than double the rate of schizophrenia.
Wow, that is a lot.
So you can see how crucial it is to have a solid understanding of these conditions and the medications that are used to treat them.
Right, so we're going to be exploring those conditions and those medications today.
Exactly.
We're going to be looking at affective disorders, anxiety, psychoses, and then the primary categories of psychotherapeutic drugs, like anxiolytics, antidepressants, mood stabilizers, and antipsychotics.
Yeah,
So we've got a lot to cover today.
we do.
Let's start with those psychiatric disorders.
Okay.
Can you give us a clear explanation of each of these disorders, keeping in mind that our listener is a nurse?
Sure. So let's start with affective disorders.
Okay.
Affective disorders are basically characterized by shifts in mood,
Okay.
and that can range from like deep depression to extreme mania.
I see.
As a nurse, have you ever observed these kinds of mood fluctuations in your patients?
Oh, absolutely. I mean, I think it's something that you see pretty frequently as a nurse.
Yeah.
You encounter patients from all walks of life, and they're dealing with all sorts of challenges. So,
Yeah.
yeah, you definitely see those mood fluctuations, and, it makes you think about what might be going on underneath the surface, right?
Absolutely. It's really important to be aware of those subtle signs, and those interactions can give you a lot of clues about what a patient might be experiencing.
Right, those observations can really be key
Yeah.
in identifying, patients who might need a little extra support
Exactly.
or further evaluation.
Right.
Okay, so we've talked about the affective disorders.
Yeah.
Let's move on to anxiety.
Okay.
Now, anxiety is something that I think most people are familiar with.
Sure.
We all experience it from time to time.
Right.
That sense of dread or fear.
Right.
But at what point does anxiety, cross the line
Right.
from just being a normal emotion to something that actually requires, like, clinical intervention?
Yeah, that's a great question.
Oh.
I think it really becomes clinically significant when it starts to interfere with a person's daily life.
Okay,
Like their work, their relationships, their well-being.
I see.
Anxiety disorders can really fall into a number of different categories.
Okay,
For example, you have generalized anxiety disorder,
yeah,
where people just worry excessively.
right.
And then there's panic disorder, which involves those really intense, sudden episodes of fear.
All right.
And then we have phobias, which are those irrational fears
Yeah.
of specific objects or situations.
Right, right. So there's like a whole spectrum of anxiety disorders.
Exactly.
Okay, so we've got the affective disorders, we've got anxiety.
Yeah.
Let's talk about bipolar disorder.
Okay.
Now, bipolar disorder is a condition that's marked by these really extreme shifts in mood,
Right.
going from mania to depression.
Exactly.
And this cycling between these two poles can really wreak havoc on a person's life,
Absolutely.
their relationships, their ability to work,
Yeah.
just their stability in general.
It can be very debilitating.
Right. And then there's depression, which presents, a different set of challenges.
Yeah.
It's not just feeling sad or blue. It's a really pervasive low mood
Right.
that affects everything.
Yeah.
A person's thoughts, their feelings, their behavior, even their physical health.
And it can be really isolating, too.
Right. And it's predicted that major depressive disorders are going to become the second leading cause of disability
Oh.
globally by 2020.
That's really significant.
It is, and it just highlights the profound impact that depression has on individuals and on society as a whole.
Yeah, definitely.
Okay, so we've talked about mania as part of bipolar disorder.
Mm-hmm.
Can you elaborate a little bit on that distinction between hypomania and mania?
Sure. So both hypomania and mania involve this kind of heightened mood and energy level.
Okay.
But hypomania is a little less severe.
Okay.
In fact, it can even be perceived as, a positive experience in the
Right.
early stages.
Right.
But if hypomania is left untreated, it can actually progress into full-blown mania.
Okay.
And mania can look like, an inability to sleep, racing thoughts and speech,
Right.
impulsive and even risky behaviors,
Ah.
and even psychotic symptoms like hallucinations hallucinations or delusions.
Wow.
So untreated mania can have some really serious consequences,
Nice to know.
potentially leading to hospitalization.
So it's really important to recognize the signs and to intervene early.
Absolutely.
Okay, let's move on to psychoses. Now, you mentioned psychoses earlier as one of the most severe categories of mental disorders.
They are.
Can you provide a bit more context on these disorders, particularly for our listener who's working in a healthcare setting?
Sure. So psychoses are really a significant disruption in a person's perception of reality.
Okay,
And a hallmark of these disorders is a loss of contact with reality.
I see.
And this often manifests as hallucinations, which are sensory experiences without any external stimuli.
Okay.
So a person might hear voices that aren't there or see things that don't exist.
Right.
In addition to hallucinations, individuals experiencing psychoses might also exhibit delusions,
Okay.
which are these firmly held beliefs that aren't based on reality.
I see.
And they're often resistant to logic or evidence.
So they're really convinced of these beliefs, even though there's no evidence to support them.
Exactly.
Okay, now schizophrenia is probably one of the most well-known examples of a psychotic disorder.
Right, it is.
But it's important to note that psychoses can also be induced by certain substances, right?
Absolutely.
Like drugs or alcohol, or they can arise as a result of underlying medical conditions.
Right.
So drug-induced psychoses can happen during intoxication or even withdrawal from certain substances.
Exactly.
So it's really crucial for healthcare professionals to be aware of this possibility when they're assessing patients with psychotic symptoms.
Yeah, for sure.
So getting a thorough medical history and doing a really comprehensive assessment is so important
It is.
to determine, what's causing these psychotic symptoms.
Absolutely. It helps you to rule out other potential causes and to make sure you're addressing the root of the problem.
Right. So we've talked about these different psychiatric disorders and the challenges that they present.
Yeah.
Let's shift gears a little bit now and talk about the medications
Okay.
that are used to treat them.
Sure.
Can you give us an overview of the different classes of psychotherapeutic drugs and how they work?
Yeah, let's start with anxiolytics.
Okay.
These are the medications that are primarily used to manage anxiety disorders. And within this class, benzodiazepines are some of the most widely prescribed.
I see.
These include drugs like alprazolam, which is marketed under the brand name Xanax,
Okay.
diazepam or Valium, and lorazepam, which is also called Ativan.
Okay.
These medications work by enhancing the activity of GABA, which is an inhibitory neurotransmitter in the central nervous system.
So GABA plays a crucial role in regulating neuronal excitability.
It does.
How does enhancing its activity help in managing anxiety?
Well, by increasing GABA activity, benzodiazepines basically reduce the overactivity of the central nervous system.
Okay.
It's kind of like applying a gentle brake
Okay.
to the excessive firing of neurons that underlies that anxiety.
I see.
So it helps to calm the nervous system and alleviate those symptoms of anxiety.
So it kind of dials down the volume on the nervous system's response to stress and worry.
Exactly.
That's a good analogy. Now, are benzodiazepines solely used for anxiety disorders, or do they have other applications?
Well, they're primarily indicated for anxiety, but they do have other uses as well.
Okay, like what?
For example, they can be used to manage the symptoms of alcohol withdrawal.
Okay.
During withdrawal, the central nervous system becomes really hyperactive as it adjusts to the absence of alcohol.
Right.
So benzodiazepines can help to kind of ease that transition
I see.
and reduce those really severe withdrawal symptoms.
Okay.
They're also used as sleep aids for people who are struggling with insomnia.
Oh.
They have muscle relaxant properties, so they can be used for muscle spasms.
Mm-hmm.
And certain benzodiazepines are also used in controlling seizures,
Wow.
particularly in emergency situations.
Okay.
And as adjuncts during anesthesia to induce sedation and amnesia.
That's a pretty diverse range of applications.
It is.
So they're quite versatile in terms of modulating that central nervous system activity.
Yeah, they really are.
Now, with any medication, though, there's always the potential for adverse effects.
Of course.
What are some of the common side effects associated with benzodiazepines?
Well, the most common adverse effects really stem from their CNS depressant effects, which is kind of an extension of their therapeutic properties.
Right.
And these can manifest as drowsiness, confusion, and a decrease in blood pressure or hypotension.
Okay.
It's really important to note that older adults are particularly susceptible to these sedative effects,
Right.
and this can increase their risk of falls,
Right.
which is why lorazepam is often preferred for older adults because it tends to carry a lower risk of falls compared to other benzodiazepines.
Oh, that's good to know.
Yeah.
So as a nurse, caring for elderly patients, that's something to really keep in mind.
Absolutely.
Monitoring for those signs of sedation and implementing those fall prevention measures.
Yeah,
That's really important.
it is.
Now, you mentioned that benzodiazepines are mainly used for the short-term management of anxiety.
Right.
Why is that?
Well, there are a couple of reasons.
Okay.
First, benzodiazepines carry a risk of dependence,
Right.
both physical and psychological.
Right.
So this means that people can develop a tolerance to the medication,
Okay.
requiring higher doses to achieve the same effect. And they can also experience withdrawal symptoms when the medication is stopped abruptly.
Right.
So to minimize these risks, they're typically prescribed for a limited duration.
Okay.
The second reason is that long-term use of benzodiazepines can actually lead to cognitive impairment,
Oh, wow.
particularly in older adults.
I see.
So chronic use can affect memory, attention, and other cognitive functions.
So it's really a balancing act, isn't it?
Is.
Between those therapeutic benefits and the potential risks.
Absolutely.
Now, for individuals who might not be suitable candidates for benzodiazepines,
Yeah.
or who require, long-term management of their anxiety, are there any alternative medications available?
Yeah, there are a few alternatives.
Okay.
One notable one is buspirone,
Okay.
which is marketed as Buspar.
Okay.
And this one is different from benzodiazepines in its mechanism of action, and it also lacks those sedative effects.
Okay.
So unlike benzodiazepines, which can be taken as needed for immediate relief from anxiety,
Right.
buspirone is typically prescribed for scheduled use. It's more about consistent long-term management of anxiety
I see.
rather than providing that immediate relief.
So it's a different approach to managing that anxiety.
It is.
Okay, so let's move on to another class of psychotherapeutic drugs.
Sure.
Mood stabilizers.
Okay.
They play a crucial role in managing conditions like bipolar disorder.
They do.
Can you tell us a little bit more about them?
Sure, lithium is considered the prototypical mood stabilizer.
Okay.
It's been used for decades to treat bipolar disorder,
Wow.
and it works by interacting with sodium ions in the body.
Okay.
And this interaction actually influences the functioning of nerve cells in ways that help stabilize mood.
I see.
So it's important to note that for your patients, their sodium intake plays a crucial role
Oh, okay.
in maintaining stable lithium levels,
I see.
because fluctuations in those levels can impact lithium's effectiveness
Right.
and could even lead to toxicity.
So maintaining a consistent sodium intake is really crucial for individuals on lithium therapy.
It is.
That's definitely something to keep in mind when you're educating patients, right?
Absolutely.
About, their diet and lifestyle factors that can affect their medication.
It's all part of that holistic approach to care.
Right. Okay. So are there any other important aspects of lithium that nurses need to keep in mind?
Yeah, lithium has what we call a narrow therapeutic range,
Okay.
which basically means that the effective dose is really close to the dose that can be toxic.
Oh, wow.
So careful monitoring of lithium blood levels is absolutely essential
Right.
to make sure that the medication stays within a safe and effective range.
So regular blood tests are crucial
They are.
for individuals taking lithium.
Right.
Okay. It sounds like a medication that requires, careful management.
It does.
Are there any other potential side effects or complications that nurses should be vigilant about?
One of the more serious concerns with lithium is the potential for cardiac dysrhythmias.
Okay.
So it's really important to monitor their heart rhythms and to be alert for any signs of cardiac issues, particularly in individuals who already have some pre-existing heart conditions.
So that's something to be really mindful of.
It is.
Now, fortunately, in recent years, there's been a growing trend towards using anti-epileptic drugs as mood stabilizers.
Right?
Medications like valproic acid
Yeah.
and lamotrigine
Uh-huh.
are often considered safer alternatives to lithium,
They are.
particularly in terms of those cardiac risks.
Yeah, they offer a broader spectrum of efficacy as well,
Okay.
effectively managing both the manic and depressive episodes in bipolar disorder.
So it's good to know that there are those options available.
It is.
Okay, so we've talked about anxiolytics and mood stabilizers.
Yeah?
Let's move on to another major class of these drugs, antidepressants.
All right.
Now, these are arguably one of the most widely prescribed drug classes today.
I would agree.
Can you walk us through their evolution a little bit
Sure.
and the different types that are available?
Yeah, so the evolution of antidepressants is really remarkable.
Yeah.
We've gone from the older tricyclic antidepressants, or TCAs,
Right.
and monoamine oxidase inhibitors, or MAOIs, to the more commonly prescribed
Yes.
selective serotonin reuptake inhibitors, or SSRIs,
Okay.
and the serotonin norepinephrine reuptake inhibitors, or SNRIs.
So it's like generations of antidepressants.
Yeah.
Each one building upon the foundation laid by its predecessor. predecessors.
Right.
So what were those tricyclic antidepressants like?
Well, they were among the first antidepressants to be discovered and used clinically.
Okay.
And they really represented a significant advancement in treating depression,
Okay.
providing relief for many people who had previously suffered with very limited treatment options.
Right.
Amitriptyline, which is marketed as Elavil, is a good example of a TCA.
Okay.
And these medications work primarily by blocking the reuptake of two key neurotransmitters in the brain, serotonin and norepinephrine.
Okay, so serotonin and norepinephrine play those crucial roles in regulating our mood, our sleep, our appetite, all those important functions.
Yeah.
How does blocking their reuptake contribute to that antidepressant effect?
Okay, so when nerve cells communicate, they release these neurotransmitters like serotonin and norepinephrine into the synapse, which is the gap between nerve cells.
Right.
And reuptake is the process by which these neurotransmitters are reabsorbed back into the nerve cell that released them,
I see.
essentially terminating their signal.
Okay.
TCAs inhibit this reuptake process,
Okay.
leading to an increased concentration of those neurotransmitters in the synapse.
Okay.
So this enhanced availability of serotonin and norepinephrine is thought to contribute to their mood-elevating effects.
So it's like boosting the signal strength of these mood-regulating chemicals.
Yeah, exactly.
Okay, so that makes sense.
Yeah.
Now, you mentioned that TCAs have uses beyond treating depression.
Yeah.
Can you elaborate on that a little bit?
Sure. TCAs have been found to be effective in managing certain types of chronic pain,
Okay.
particularly neuropathic pain, which arises from nerve damage.
Yeah.
And they can also be helpful in treating insomnia because they promote sleep by blocking the actions of histamine, which is another neurotransmitter involved in wakefulness.
So their effects extend beyond just mood regulation.
Right.
Now, we know that medications often come with a set of potential adverse effects.
Yeah.
What are some of the common side effects associated with TCAs?
Well, TCAs can cause a range of side effects that are related to their actions on various receptors in the body.
I see.
Common ones include those anticholinergic effects like dry mouth,
Okay.
constipation, and urinary retention.
Right.
They can also cause drowsiness due to their sedative properties.
Okay, so those side effects, while not typically life-threatening,
Right.
can definitely impact a person's quality of life
Absolutely.
and even their adherence to the treatment.
Yeah, for sure.
So are there any serious safety concerns associated with TCAs?
One of the most significant concerns is the potential for lethal overdose,
Okay.
particularly when taken in combination with alcohol.
Wow.
This is because both TCAs and alcohol depress the central nervous system,
Right.
and their combined effect can actually lead to respiratory depression
Wow.
and cardiac arrest.
That's serious.
It is, so it's really important to emphasize medication safety
Right.
and to educate patients about the risks of overdose.
Especially in the context of alcohol consumption.
Exactly.
Right. So that patient education piece is really crucial
It is
in mitigating those risks.
Often.
Okay, so let's shift our attention to another class of those older antidepressants, the monoamine oxidase inhibitors, or MAOIs.
Okay.
They're not as commonly prescribed as TCAs or the newer antidepressants. Why is that?
Well, MAOIs work by inhibiting the enzyme monoamine oxidase,
Okay.
which is responsible for breaking down neurotransmitters like dopamine, serotonin, and norepinephrine in the brain.
Okay.
So by inhibiting this enzyme, MAOIs actually increase the levels of these neurotransmitters,
Right.
which is thought to contribute to those mood-elevating effects.
Okay, so why aren't they used as much?
Their use is limited due to the risk of a potentially life-threatening condition called a hypertensive crisis. And this can occur when MAOs are combined with certain foods that are rich in tyramine or with certain medications.
So dietary restrictions are a major concern with MAOIs.
They are.
Can you give us some examples of foods that need to be avoided?
So people taking MAOIs need to be extremely cautious about their diet.
Okay.
They must avoid foods that are high in tyramine,
Okay.
such as aged cheeses, cured meats,
Okay.
fermented products like sauerkraut and soy sauce,
I see.
and certain alcoholic beverages like red wine and beer.
Oh, wow.
Even small amounts of these foods can trigger a sudden and dangerous increase in blood pressure.
Wow. So it's a very specific and potentially challenging dietary restriction for patients to adhere to.
Absolutely. And that's one of the main reasons why they're not as commonly prescribed as other antidepressants.
I see.
But there are some MAOIs that are less restrictive in terms of diet. For instance, the transdermal patch formulation of saligeline,
Okay.
which is marketed as MSAM, carries fewer dietary restrictions at lower doses.
Well, that's good to know.
It is.
So that's an option for patients who might not be able to adhere to those stricter dietary requirements.
Exactly.
So it seems like there's always a trade-off, isn't there?
There is.
Between efficacy and safety and practicality
Absolutely.
when it comes to these medications.
And it's really important to weigh those factors carefully when choosing the most appropriate treatment for each individual patient.
Absolutely.
Yeah, it's a balancing act for sure. So let's shift gears a little bit and talk about those second-generation antidepressants.
Okay.
These are the SSRIs and the SNRIs that we hear so much about.
Right.
They've really made a big difference in terms of safety and tolerability.
Right. They're generally well tolerated.
Yeah.
So can we dive into the specifics a little bit, starting with SSRIs?
Okay.
What's their mechanism of action? How do they actually work to alleviate, those depressive symptoms?
So as their name suggests, SSRIs selectively block the reuptake of serotonin in the brain.
Okay.
This basically means that there's more serotonin available to bind to its receptors and to exert those mood-regulating effects.
So it's kind of like increasing the availability of that key neurotransmitter.
Exactly.
Now, fluoxetine, or Prozac, as it's more commonly known,
Right.
Was kind of the pioneer of the SSRIs, wasn't it?
It was one of the first medications in this class to really gain widespread recognition and use.
Right. And it really demonstrated the effectiveness of SSRIs in treating both depression and anxiety.
It did.
Now, let's talk about SNRIs.
Okay.
As the name implies, I guess they block the reuptake of both serotonin and norepinephrine.
They do.
Duloxetine, or Cymbalta,
Right.
is a well-known example of an SNRI.
It is.
So they target both serotonin and norepinephrine,
Yes.
which are both, implicated in mood regulation.
Right.
What are the implications of that dual action? Does it offer any advantages or disadvantages?
Well, targeting both serotonin and norepinephrine can actually provide a broader spectrum of therapeutic effects.
Okay.
So we see SSRIs and SNRIs used for depression, as you mentioned.
Right.
But they're also very effective in treating a range of anxiety disorders.
Like what?
Generalized anxiety disorder, social anxiety disorder, panic disorder, and even post-traumatic stress disorder.
Wow.
All of these can respond really well to SSRIs and SNRIs.
Okay.
Additionally, SNRIs in particular have shown some real efficacy in managing chronic pain conditions.
Okay, like what kind?
Things like fibromyalgia and neuropathic pain.
Okay, that's interesting.
So it's a pretty impressive range of applications.
It is. It's quite remarkable how these medications can address, such a diverse array of conditions.
Yeah, I agree.
But with any medication, we have to think about the potential downsides.
Right.
Even though SSRIs and SNRIs are generally well tolerated,
Yeah.
side effects are still a possibility.
Of course.
What are some common side effects that patients might experience?
Well, some common complaints include things like insomnia, weight gain, and sexual dysfunction.
Okay.
Insomnia can manifest as difficulty falling asleep or staying asleep, or even experiencing those early morning awakenings.
I see.
Weight gain, although it's not universal,
Right.
can occur in some individuals
Okay.
and might be attributed to changes in appetite or metabolism.
I see.
And sexual dysfunction can take many forms,
Okay.
including decreased libido, difficulty achieving orgasm, or delayed ejaculation.
Oh.
So while these side effects are often manageable, they can be frustrating for patients,
Right.
and they can impact their adherence to the treatment.
Absolutely.
Yeah.
So having those open and honest conversations with patients is really important
It is.
so that they feel comfortable, discussing those concerns and exploring those strategies to manage them.
Absolutely. Open communication is key.
It is now beyond those common side effects. Are there any other risks associated with SSRIs and SNRIs?
Yeah, there is one risk in particular that I think deserves special attention.
Okay.
Serotonin syndrome.
Serotonin syndrome.
Yeah.
What is that?
This condition basically arises when there's excessive serotonin activity in the body. And it's typically triggered by using serotonergic medications like SSRIs and SNRIs,
Right.
especially when these medications are combined with other drugs or substances that also increase serotonin levels.
Oh, wow. So that sounds serious.
Can be.
What are some of the signs and symptoms of serotonin syndrome that nurses should be aware of?
Okay, so serotonin syndrome can present with a variety of symptoms,
Okay.
ranging from mild to severe,
Okay.
but it often manifests with mental status changes.
Right.
So things like confusion, agitation, even delirium.
Wow.
Autonomic instability is another hallmark of serotonin syndrome.
Okay.
And that's characterized by fluctuations in blood pressure, heart rate, and body temperature.
I see.
We can also see neuromuscular hyperactivity, which
Yeah.
can manifest as tremors, muscle rigidity, and clonus,
Okay.
which are those involuntary rhythmic muscle contractions.
I see.
And in severe cases, serotonin syndrome can actually progress to seizures, coma, and even death.
Wow.
So it's crucial to recognize these signs early
Right.
and to intervene promptly
Absolutely.
to prevent those potentially life-threatening complications.
Now, thinking about our listener's role as a nurse,
Yeah.
it's really important to be able to differentiate serotonin syndrome
Right.
from other conditions that might present with similar symptoms.
It is.
So it really highlights the importance of a thorough patient assessment,
Yes.
obtaining a detailed medication history, including any over-the-counter drugs or supplements,
Right.
and just maintaining a high index of suspicion when you're encountering these types of symptoms.
Absolutely.
Now, you mentioned that SSRIs and SNRIs should not be stopped abruptly.
Right.
Can you explain why that is and what might happen if they are?
Okay, so when SSRIs and SNRIs are discontinued abruptly,
Okay.
they can actually lead to a cluster of symptoms that we call discontinuation syndrome.
Discontinuation syndrome.
Yeah.
What is that?
So this is different from withdrawal,
Okay.
which usually involves more severe symptoms and physiological dependence. Discontinuation syndrome is thought to be caused by the brain's adaptation to the presence of these medications.
I see.
When the medication is suddenly stopped, the brain has to readjust.
Right.
And this can lead to a range of uncomfortable symptoms.
Okay, so what are some of those symptoms of discontinuation syndrome?
Well, discontinuation syndrome can present with a variety of symptoms
Okay.
that are often described as flu-like.
Flu-like?
Yeah, so you might see things like fatigue, headache, muscle aches,
Okay.
gastrointestinal upset,
Okay.
nausea, vomiting, diarrhea,
Okay.
dizziness, vertigo, insomnia are also common.
Wow.
Some people describe experiencing electric shock-like sensations,
Really?
often called brain zaps.
Well,
So these symptoms typically emerge within a few days of stopping the medication, and they can last for a week or two.
wow.
And while they're not usually serious,
Right.
they can be quite distressing for patients
Okay.
and can impact their daily functioning.
So it's really about managing that transition off of these medications carefully to minimize that discomfort.
Absolutely.
Tapering the dose gradually rather than stopping abruptly
Yeah.
is generally recommended to reduce that risk of discontinuation syndrome.
It's definitely good practice to taper the dose gradually,
Okay.
especially for people who have been on the medication for a long time
Right.
or who are taking higher doses,
Okay.
because it allows the body to adjust more gradually to
Right.
those decreasing levels of medication.
Makes sense.
And it minimizes the chance of experiencing those uncomfortable withdrawal symptoms.
Okay, so we've covered SSRIs and SNRIs pretty extensively.
We have.
Are there any other antidepressants that you want to highlight?
Sure. There are a couple of others that deserve mention.
Okay.
One is bupropion,
Okay.
which is sold under the brand name Wellbutrin.
Well, Butrin.
Yeah.
I've heard of that one.
And this one's interesting because it's different from SSRIs and SNRIs in its mechanism of action.
Okay, how so?
Bupropion primarily targets dopamine and norepinephrine
Okay.
with very minimal effects on serotonin.
So it's kind of like a different pathway,
Is.
mood regulation,
Yeah, exactly.
bypassing that serotonin system.
Right.
So are there any other advantages to using bupropion?
Yeah, another really interesting thing about bupropion is that it can be used for smoking cessation.
Really?
It's actually marketed under the brand name Zyban for this purpose.
Zuban.
Wow, I didn't know that.
And it's thought that its effects on dopamine and norepinephrine help to reduce cravings and withdrawal symptoms.
Wow, that's fascinating.
So it's a really interesting medication with multiple uses.
It is. It really speaks to that complexity of the brain and how, medications can target specific neurotransmitter systems to achieve those desired outcomes.
Exactly.
Are there any other unique antidepressants that we should talk about?
One more that's worth mentioning is trazodone,
Okay.
also known as Deserol.
Okay.
And this one's known for its strong sedative qualities,
Oh, okay.
making it particularly helpful for people who struggle with insomnia
Right.
alongside depression. So it kind of addresses both of those issues.
It does. It's often prescribed at lower doses just for its sleep-promoting effects.
Okay.
It can help people fall asleep easier and stay asleep throughout the night.
So it's kind of like a 2-for-1.
Yeah, you could say that.
It's good to know. So we've covered a wide range of
Oh,
antidepressants,
yeah,
from those older TCAs and MAOIs to the newer SSRIs and SNRIs and even some miscellaneous agents.
right.
It's a pretty complex landscape.
It is a fascinating one, but definitely complex.
Now let's transition to that final category of psychotherapeutic
Yeah,
drugs that we're going to be talking about today.
sure.
Antipsychotics.
Yeah.
These medications play a crucial role in managing severe mental illnesses,
They do.
particularly psychoses.
Right.
So how are they classified?
Okay, so antipsychotics are broadly divided into two categories.
Okay.
Conventional antipsychotics,
Okay.
also known as first-generation antipsychotics,
Okay.
and atypical antipsychotics, or second-generation antipsychotics.
So two main categories.
Right. And the conventional antipsychotics were the first to be discovered and used clinically.
I see.
And they work primarily by blocking dopamine receptors in the brain,
Okay.
particularly in the areas that are associated with emotions, thinking, and movement.
Okay.
Haloperidol, which is marketed as Haldol,
Okay.
is a good example of a conventional antipsychotic.
Okay, so by blocking those dopamine receptors, they're essentially dampening the activity of dopamine in those brain regions.
Exactly.
So how does that impact the symptoms of psychosis?
Okay, so dopamine plays a complex role in brain function,
Okay.
and its dysregulation is really implicated in the development of psychosis.
Right.
So conventional antipsychotics, by reducing dopamine activity,
Okay.
can actually alleviate those positive symptoms of psychosis.
Okay.
Things like hallucinations, delusions, and disorganized thinking.
So they're effective in reducing those symptoms that add to or distort a person's reality.
Right.
Now, you mentioned that there's another category of antipsychotics, the atypical antipsychotics.
Yeah.
What makes them different from the conventional antipsychotics?
So atypical antipsychotics emerged really as a response to the limitations of those conventional antipsychotics.
Okay.
They offer several advantages.
Okay, like what?
Well, they have a broader spectrum of efficacy.
Okay.
So they target both the positive and negative symptoms of psychosis.
I see.
And they also have a more favorable side effect profile
Yeah.
with a lower risk of those extrapyramidal symptoms that we talked about earlier.
Okay, so that's good.
Clozapine, which is marketed as Clozaril, was actually the first atypical antipsychotic to be discovered.
Really?
And it really set a new standard in the treatment of schizophrenia,
Wow.
demonstrating superior efficacy in treating both those positive and negative symptoms,
Okay.
particularly in individuals who hadn't responded well to other antipsychotics.
So that was a big breakthrough.
It was.
Okay, so what's their mechanism of action? How do they differ from those conventional antipsychotics?
So atypical antipsychotics differ from the conventional ones
Okay.
in their receptor binding profiles. Okay.
So they not only block dopamine receptors,
Okay.
but they also have an affinity for serotonin receptors.
So it's that dual action
It
that
is.
makes them different.
Exactly. And
Yeah.
it's thought that this dual action on both those dopamine and serotonin systems
Right.
is what contributes to their broader efficacy
Right.
and that reduced risk of extrapyramidal symptoms.
So they target multiple neurotransmitter systems.
They do.
How does that translate to their use in practice?
Well, atypical antipsychotics are very effective in treating both the positive and negative symptoms of schizophrenia.
Okay.
Like we said, hallucinations and delusions.
Right.
But also those negative symptoms,
Okay.
like apathy, social withdrawal, and flat affect.
I see.
And they're actually being used increasingly for conditions beyond schizophrenia.
Like what?
For example, they've shown promise in treating bipolar disorder,
Okay.
particularly those manic episodes.
Okay.
And they can also be used as adjunctive therapy in treatment-resistant depression.
Oh, so they can enhance the effects of antidepressants.
So they're really quite versatile.
They are.
Okay, so let's talk about those side effects a little bit.
Okay.
What are some of the concerns with those conventional antipsychotics that led to the development of the atypicals?
Well, one of the most significant drawbacks of conventional antipsychotics
Yep.
is their propensity to cause extrapyramidal symptoms, or EPS.
EPS.
Yeah,
Okay, so those are those movement disorders that can be really distressing for patients
they can be.
and can significantly impact their quality of life.
Absolutely.
Can you describe some of those common extrapyramidal symptoms?
Sure. So they can manifest in a variety of ways.
Okay.
Akathisia is one,
Okay.
which is characterized by a subjective feeling of restlessness and an inability to sit still.
Okay.
People experiencing akathisia might pace back and forth, fidget constantly, or shift their weight from leg to leg.
I see.
Dystonia is another IPS,
Okay.
and this involves involuntary muscle spasms and contractions, and
Yeah.
it can affect various muscle groups. leading to contorted postures, facial grimacing,
Wow.
and even difficulty speaking or swallowing.
Oh, wow.
And then we have pseudoparkinsonism,
Okay.
which, as the name suggests, mimics the symptoms of Parkinson's disease.
Right.
So you might see tremors, muscle rigidity, slowed movements, a shuffling gait.
Those are all very challenging side effects.
Yeah,
To
definitely
manage.
sure.
They can really impact a person's, physical functioning, their social interactions, just their overall well-being.
Absolutely.
And these are just a few examples of the EPS that can occur with conventional antipsychotics.
Right.
It's important to note that tardive dyskinesia,
Yes.
which is a potentially irreversible movement disorder,
Is
is another serious concern
a very serious concern.
with these medications.
And this one typically develops after prolonged exposure to antipsychotics,
Okay.
often months or even years of treatment.
Wow.
And it involves these involuntary repetitive movements,
Okay.
often affecting the face, the mouth, the tongue, and the limbs.
So it's not something to be taken lightly.
No, it's not.
So those are definitely risks that need to be weighed carefully when you're prescribing these conventional antipsychotics.
Absolutely.
It seems like the development of those atypical antipsychotics was a really important step
It was.
in trying to mitigate those side effects.
Yeah, for sure.
Now, do the atypical antipsychotics come with their own set of side effects?
They do.
What should nurses be aware of?
Okay, so while atypical antipsychotics generally have a more favorable side effect profile,
Right?
they still have their own set of potential adverse effects.
Okay.
Weight gain is a significant concern with some atypical antipsychotics.
Okay.
For instance, clozapine and olanzapine
Boy.
are particularly associated with this side effect.
Right.
Other atypical antipsychotics,
Okay.
like risperidone and quetiapine,
Okay.
carry a lower risk of weight gain.
I see.
And ziprasidone is often considered weight neutral.
Okay, so there's like a range
Yeah.
of risk when it comes to that weight gain.
There is.
So it's important to think about those individual patient factors,
Yes.
like their baseline weight, their metabolic status,
Right.
and their personal preferences
Sure.
when you're choosing the most appropriate medication.
Absolutely.
Now, beyond weight gain, is there anything else that we should be thinking about?
Yeah, we also see an increased risk of metabolic syndrome with atypical antipsychotics.
Okay.
And metabolic syndrome is basically a cluster of conditions
Okay.
that increase a person's risk of cardiovascular disease, stroke, and type 2 diabetes.
Right.
So these conditions include things like abdominal obesity,
Okay.
high blood pressure, elevated blood sugar levels, and abnormal cholesterol levels.
So it's not just about the weight.
It's not.
It's about all these other metabolic changes that
Yeah.
can have long-term health implications.
Yeah, exactly.
So it highlights the importance of, doing that comprehensive monitoring for patients on these medications.
Absolutely.
Regularly checking their weight, their
Yeah.
blood pressure, their blood sugar, their lipid levels.
It's really important for early detection
Right.
and management of any of those metabolic disturbances.
Now, are there any lifestyle modifications
Yeah.
that can help to mitigate these risks?
Sure, lifestyle modifications can play a big role.
Okay.
Things like dietary changes,
Okay.
increased physical activity,
Right.
and smoking cessation.
Okay. So it's really about that holistic approach to patient care,
It is.
right? Addressing both the mental and physical health needs
Exactly.
of individuals taking these medications.
It's all connected.
Now, are there any other safety concerns associated with antipsychotics?
Yeah, both typical and atypical antipsychotics carry black box warnings.
Black box warnings.
Yeah.
What are those?
These are the strongest warnings that are issued by the Food and Drug Administration.
Okay.
And they highlight serious safety concerns
Right.
that healthcare providers and patients need to be aware of.
Okay. What kind of concerns are we talking about?
Well, one warning is about an increased risk of death in older adults with dementia who are taking these medications.
Nice.
And this risk is especially high in people with dementia-related psychosis.
So that's a very serious concern,
It is.
especially given the vulnerability of that population.
Absolutely.
What about other black box warnings?
Another one relates to an increased risk of suicidal thoughts and behaviors
Okay.
in children and young adults taking antipsychotics.
I see.
And this risk actually applies to both the typical and atypical antipsychotics.
Okay.
And it seems to be particularly elevated in those early stages of treatment.
So that's something to be very aware of.
It is.
It really emphasizes the need for those ongoing assessments,
Yes.
open communication with patients and their families,
Right.
and just prompt intervention if any concerning signs or symptoms emerge.
Exactly.
So it's about prioritizing patient safety
It is.
above all else.
Absolutely.
Now, you mentioned earlier that antipsychotics shouldn't be stopped abruptly.
Right.
Why is that?
Well, stopping them abruptly can actually lead to withdrawal symptoms
Okay.
and even a relapse of those psychotic symptoms.
So tapering is essential
It is.
when you're discontinuing these medications.
Yes. Gradual tapering is generally recommended,
Okay.
particularly for those who have been on the medications for a long time
Right.
or who are taking higher doses.
Okay.
This helps to minimize those withdrawal symptoms
Okay.
and prevent that sudden return of psychotic symptoms.
So let's talk about some specific examples of antipsychotics,
Okay.
starting with haloperidol,
Okay.
a classic conventional antipsychotic.
Right.
What are some of the key points to remember about it?
Okay, so haloperidol is a high-potency antipsychotic,
Okay.
which means it's effective at relatively lower doses
Okay.
compared to some other antipsychotics.
I see.
But this high potency also means it comes with a higher risk of those extrapyramidal symptoms.
Right, those movement disorders.
Exactly.
What about different formulations of haloperidol?
So it's available in a variety of forms,
Okay.
including oral tablets, intramuscular injections, and even a long-acting injectable form
Really?
called haloperidol decanoate.
Oh, that's good to know.
It is.
So that could be really helpful for individuals who struggle with, adhering to those daily oral medications.
Absolutely. It can be especially helpful for people with chronic psychosis
Okay.
who might have difficulty remembering to take their medication regularly.
Right.
So it provides a more consistent level of medication in the bloodstream,
Okay.
which improves symptom control and reduces that risk of relapse.
So that's a really valuable option.
It is.
Now, you mentioned clozapine as the first atypical antipsychotic.
I did.
What makes it stand out from the others?
So clozapine is unique
Okay.
because it's highly effective for treatment-resistant schizophrenia.
Okay.
And that refers to individuals who haven't responded well to at least 2 other antipsychotic medications,
Okay.
including at least 1 atypical.
Okay.
So clozapine can often provide significant symptom relief
I see.
for these individuals and improve their quality of life and reduce that need for hospitalization.
That's really important.
It is, but
Yeah.
there is a downside.
Okay, what is it?
Its use is associated with a rare but potentially life-threatening blood disorder called a granulocytosis.
A granulocytosis.
Wow.
So it's kind of a double-edged sword, isn't it?
It is. It offers that remarkable efficacy,
Right.
but it also carries a significant risk
Right.
that requires really careful monitoring.
So because of that risk of a granulocytosis, clozapine is only available through a restricted program
Right.
called the clozapine REMS program.
Correct.
What does that entail?
So this program involves mandatory blood monitoring
Okay.
to detect any signs of granulocytosis early
Okay.
and to intervene promptly.
Okay, so what does that monitoring look like?
So patients starting clozapine are required to have their white blood cell counts checked weekly
Okay.
for the first 6 months of treatment.
Wow.
If their blood counts remain stable,
Right.
the monitoring frequency can be reduced to every other week. But lifelong blood monitoring is still recommended,
Wow.
even after years of treatment.
So it's a big commitment
It is.
for both the patient and the healthcare team,
Absolutely.
but it's necessary to mitigate that risk.
Exactly.
Okay, so let's talk about another widely used atypical antipsychotic, risperidone.
Okay.
What are its key characteristics?
Risperidone is another very effective atypical antipsychotic.
Okay.
It's indicated for the treatment of both the positive and negative symptoms of schizophrenia,
Right.
and it's also shown efficacy in managing bipolar disorder.
Oh, wow.
Like the other atypical antipsychotics,
Yeah.
it has a lower risk of those extrapyramidal symptoms
Right.
compared to the conventional antipsychotics.
Okay. And what about different formulations?
So it's available in a variety of formulations,
Right.
including oral tablets, a liquid solution,
Okay.
and a long-acting injectable form called Risperidol Consta.
So again, that long-acting injectable formulation could be really helpful for individuals who have difficulty adhering to those daily medications.
Absolutely.
Okay, so it sounds like those atypical antipsychotics have really expanded the treatment options,
They have.
for these serious conditions.
They've given us more tools to work with.
Right, they offer that broader spectrum of efficacy,
Right.
that more favorable side effect profile,
Right.
and those flexible dosing options.
They do.
And it seems like, we continue to see new atypical antipsychotics emerging,
We do.
each with its own, unique profile
Right.
of benefits and risks.
Exactly.
And it's really driven by, that desire to create medications
Yeah.
that are more effective, safer, and better tailored to those individual needs.
Absolutely. It's a constant evolution.
It is. It's a fascinating area of pharmacology,
It is.
constantly evolving with those new discoveries.
Absolutely.
So as healthcare professionals, it's really our responsibility to stay informed about these advancements
It is.
so that we can provide the best possible care.
Right. Staying informed about those latest developments is essential. It allows us to make those informed treatment decisions.
Right.
Anticipate those potential side effects, interactions.
Right.
And just provide that optimal care
Right.
that really aligns with current best practices.
Now, we've covered a lot of ground today.
Really?
Those different psychiatric disorders
Yeah.
to the medications used to treat them.
Right.
I'm sure our listener has gleaned a lot of
I
information
thought so.
from this deep dive.
Yeah, we've explored the mechanisms of action, the indications, the potential side effects, and the nursing considerations for each of those major classes.
Right.
It's a complex and multifaceted topic.
It is.
But understanding these nuances is really essential for providing safe and effective care
Right.
to individuals living with these conditions.
Before we wrap up, I'd like to maybe touch on some key nursing considerations.
Sure.
Insights that might be valuable for our listener,
Okay.
given their dual role as a nurse and a student,
Right.
to help them navigate the practical aspects of caring for these patients.
Absolutely. Let's do that.
So let's start with the basics.
Mm.
What are some, overarching considerations that nurses should keep in mind when caring for patients who are receiving these psychotherapeutic medications?
Well, I think a comprehensive patient assessment is really essential before you administer any of these drugs.
Okay.
A thorough physical exam, a detailed mental status evaluation, and a complete review of their medical history.
Right. Any pre-existing conditions,
Right.
allergies,
Yeah.
current medication.
Exactly. All of that.
Okay.
And then meticulous documentation of these findings is absolutely crucial.
Okay.
It establishes a baseline for comparison and ongoing monitoring.
So we're establishing that baseline
Right.
at the very beginning.
Exactly.
And then we can use that
Yeah.
to assess the effectiveness of the medication, to monitor for any side effects or complications, and to make any adjustments to the treatment plan.
It's really the foundation for individualized care.
Okay, now what about the patient's mental state?
Mm.
Many patients who are receiving these medications might be experiencing depression.
Right.
So how does that factor into their care?
Well, depression can manifest in a lot of ways.
Okay.
Not just emotionally and cognitively,
Yeah.
but also behaviorally.
Right.
Depression can lead to insomnia, fatigue, loss of appetite, even self-neglect.
Right.
So it's important to pay close attention to the patient's sleep habits,
Okay.
their nutritional intake, and any significant changes in their overall health status.
So it's about addressing the whole person.
It's about that mind-body connection.
Right.
You can't separate the two.
Okay, so we've talked about, the assessment piece.
Yeah.
What about those crucial safety checks?
Right. So before you administer any medication, it's vital to check for drug allergies,
Okay.
any contraindications,
Right.
potential drug interactions.
Okay.
All of that should be meticulously documented.
Right. It's all about minimizing those risks and maximizing the potential benefits.
Right. Exactly. Striking that balance between efficacy and safety.
That's a good way to put it.
It's really at the core of responsible psychopharmacological care.
Now let's talk about some specific nursing considerations related to each of these drug classes.
Sure.
Let's start with anxiolytics,
Okay.
particularly benzodiazepines.
Right.
What are some of the key nursing implications?
Oh, when you're administering benzodiazepines, especially when they're given intravenously,
Right.
careful monitoring of vital signs is really important.
Okay.
Pay close attention to the patient's blood pressure
Okay.
because benzodiazepines can cause orthostatic hypotension.
Orthostatic hypotension.
Yeah, which is that drop in blood pressure upon standing.
Right. And that can lead to dizziness, lightheadedness, even fainting,
Exactly.
which increases that risk of falls, especially in older adults.
Right.
So what are some ways to mitigate that risk?
Well, you want to encourage patients to change positions slowly,
Okay.
to sit at the edge of the bed for a few moments before they stand up, to use assistive devices if necessary, like walkers or canes.
Okay.
Compression stockings can also be helpful.
Okay. So it's a combination of, patient education, environmental modifications,
Right.
and assistive devices.
That's a multi-pronged approach.
It is. Now, what about the patient's anxiety level? Patients who are taking benzodiazepines might be experiencing, heightened anxiety or even panic attacks.
Right. Creating a calm and therapeutic environment can really help
Okay.
to reduce their anxiety and promote a sense of safety.
That makes sense.
Yeah,
Sometimes those simple interventions can make a big difference.
absolutely.
A calm voice, a gentle touch,
Right?
just a reassuring presence can really help.
It's about that human connection.
It is.
Now, when you're administering benzodiazepines intravenously,
Okay.
it's crucial to follow strict safety protocols.
Right.
Always double check the orders, verify the patient's identity,
Okay.
use the right diluent,
Right.
and administer the medication over the recommended time.
Those steps are so important,
They,
even though they might seem routine.
it's about preventing medication errors.
Right. Okay, let's move on to mood stabilizers,
Okay.
specifically lithium.
Okay.
What are some key considerations for lithium?
Lithium is a really effective mood stabilizer,
Right.
but it does have that narrow therapeutic range
Right.
and the potential for toxicity.
Right.
So careful monitoring and patient education are really key.
Okay, so what are some of those key points?
Well, one of the most crucial things is making sure the patient is adequately hydrated.
Cool.
Dehydration can actually increase those lithium levels in the bloodstream,
Right.
which can lead to toxicity.
Okay.
So patient education about maintaining fluid intake is really important.
So what are some practical tips that we can give to patients?
Well, encourage them to drink plenty of fluids throughout the day,
Okay.
to carry a water bottle with them,
Right.
and to avoid beverages that can dehydrate, like caffeine or alcohol.
Right.
And then, of course, monitoring their urine output
Oh.
and assessing for any signs of dehydration,
Mm.
like dry mouth, decreased urine output, dizziness.
Okay, so beyond hydration,
Yeah.
what else should we be thinking about?
Monitoring those lithium blood levels is essential
Right.
to ensure the medication stays in that safe and effective range.
Right.
So those blood draws are typically scheduled at regular intervals,
Okay.
especially in the initial phase of treatment,
Well,
so we can assess their response and make any necessary adjustments.
and of course, we need to educate them about those potential side effects.
Absolutely.
Things like tremors, weight gain, gastrointestinal upset.
Right.
So open communication about those side effects
Yeah,
and how to manage them is really important.
it is.
Okay, let's move on to antidepressants.
Okay.
What are some general nursing considerations for this class of drugs?
Well, with antidepressants,
Yeah.
especially the SSRIs and SNRIs,
Okay.
you have to remember that the therapeutic effects usually take several weeks
Oh, wow.
to really become apparent.
Okay.
So patients might not experience that immediate relief from their symptoms, and that can be discouraging.
Right.
So it's important to educate them about that delayed onset of action
No.
and emphasize the importance of adherence,
Right.
even if they don't feel better right away.
So patience is key.
Patience and reassurance
Oh.
during those first few weeks of treatment.
Absolutely. Now, you mentioned earlier that there's that potential risk of suicidal thoughts and behaviors,
Yeah.
especially in those early stages of treatment.
Right.
So how do we manage that risk?
Well, vigilance is really key,
Okay.
especially during those first few weeks or months of treatment.
Okay.
You want to look for any sudden changes in mood or behavior,
Okay.
any expressions of hopelessness or worthlessness,
Right.
talk of death or suicide, or
Right.
any unusual behaviors
Okay.
that deviate from their baseline.
So any red flags?
Exactly. You want to err on the side of caution and consult with the prescriber
Absolutely.
if you see any of those warning signs.
Okay, so those TCAs and MAOIs, those older classes of antidepressants, they come with their own unique set of considerations.
They do.
What are some key points for those?
With TCAs, you really want to watch for those anticholinergic side effects.
Okay.
Things like dry mouth constipation,
Right.
urinary retention, blurred vision,
Uh-huh.
even cognitive impairment.
Wow.
So educating patients about these side effects,
Okay.
providing strategies to manage them,
Right.
and emphasizing that open communication is really important.
Right. So with MAOIs, those dietary restrictions are really important,
Absolutely.
to avoid that hypertensive crisis.
Exactly.
So providing detailed education about those dietary restrictions
Right.
and a list of foods to avoid.
Yeah.
That's essential.
It is. And regular blood pressure monitoring, especially
Right.
in the beginning,
Right,
is
yeah.
also recommended.
Okay, let's talk about antipsychotics.
Okay.
What are some key considerations for this class?
With conventional antipsychotics,
Okay.
monitoring for those extrapyramidal symptoms is really important. You want to be vigilant for any signs of akathisia dystonia,
Okay.
pseudoparkinsonism, tardive dyskinesia.
Right.
Early detection of these movement disorders is essential
Right.
to intervene and prevent those long-term complications.
So observing their movements, their gait, their facial expressions,
Yes.
All of that can provide valuable clues.
Observation is a key part of nursing assessment.
It is. And with those atypical antipsychotics,
Yeah.
while they have that lower risk of EPS,
Right.
monitoring for metabolic side effects is really important.
It is.
So we're talking about weight, blood pressure, blood sugar, lipid levels.
Exactly. It's that holistic approach.
It is.
Recognizing that these medications can impact different systems.
Right.
And that comprehensive monitoring is essential.
So we've covered a lot of ground today,
We have.
in terms of those nursing considerations.
Right. We've talked about assessment monitoring,
Right.
patient education, safety protocols,
Right.
the importance of individualized care,
Absolutely.
and a collaborative approach.
Now, before we wrap up this deep dive,
Yeah.
I want to revisit our learning objectives.
Okay.
We set out to understand those major categories of psychiatric disorders,
Right.
how they present,
Yeah.
the mechanisms of action of these different drugs,
Right.
their indications, their potential side effects, and their nursing implications.
Absolutely.
And I think we've covered all of those objectives in great depth.
We've really delved into each class of psychotherapeutic drug,
Right.
providing that framework for understanding, their uses, their
Right.
potential benefits and risks,
Right.
and the key considerations for safe administration.
Absolutely. Well, thank you so much for joining us on this deep dive into the world of psychotherapeutic drugs.
It's been a pleasure.
We've covered a lot of information today,
We have.
but I hope you found it helpful.
I hope so too.
And I encourage you to continue learning, stay up to date on the latest developments in psychopharmacology, and approach each patient encounter with empathy, curiosity,
Yeah.
and that commitment to providing holistic and evidence-based care.
Couldn't have said it better myself.
Well, thank you again for joining us.
Thank you for having me.